Jonathan Kotch is a research professor of maternal and child health at the UNC Gillings School of Global Public Health, where he has been on the faculty since 1978. Dr. Kotch's research is focused on the causes and consequences of child maltreatment and the health and safety of children in out-of-home child care, including nutrition and physical activity. Dr. Kotch.
I need to acknowledge the people who contributed to this presentation, namely the Maternal and Child Health Bureau of US DHHS, the Health Resources and Services Administration, who gave 2 grants that resulted in the projects whose results I'm going to share with you, and the Head Start National Center on Health, which provided most of the pictures from their open source library, and lastly, the colleagues and co-authors of the papers that I'm going to be discussing. 2 things I want to accomplish, and I have to share with you the fact that it's very hard for a professor to talk in 10 minutes what I usually prepare in 50, so I'm going to be talking a little bit fast. But I do want to describe the role of child care health consultants in health and safety training, technical assistance, and consultation in early care and education settings in the United States, and then discuss the successful nutrition and physical activity interventions by child care health consultants that we've documented at UNC. So what is child care health consultation? It is a process of child health professionals, and I have to emphasize the health part of health professionals, and early care and education staff working together to promote healthy and safe environments for young children. And a consultation is a process that's initiated by the client, in this case, the early care and education facility, to resolve a health or safety concern, improve the health and safety components of child care programs. We emphasize the collaborative nature of consultation and the voluntary nature of consultation. But we'll get on a little bit and talk about consultation and technical assistance as we go along. So who is a child care health consultant? Again, it's a child health professional who is interested in, experience with children, has knowledge of resources and child care regulations, comfortable linking child care with health resources in the community, and has successfully completed a qualifying training that is based on the standard reference for child care health and safety, namely Caring for Our Children, and that was produced by the National Resource Center that we've already heard referred to in collaboration with Maternal and Child Health Bureau, American Academy of Pediatrics, and the American Public Health Association. And you'll see in this graphic a child care health consultant in training studying from her textbook, Caring for Our Children. So what do child care health consultants do? They are the people who go into the child care facilities with a clipboard, or today with an iPad, and assess health and safety policies and practices on site in the centers, offers health education for staff, parents, and children, provides consultation, training, and technical assistance on health and safety topics, including nutrition and physical activity. And we've just heard about the importance of how following up some of the online web-based training that's available these days with coaching on the ground, on site, is so important. It's child care health consultants who do that every day. Lastly, for this slide, provides resource and referral information to families and to the child care providers. In addition, child care health consultants can review policies, procedures, and staff and children's health records. Many, in fact, the majority of child care health consultants are nurses. They have access to the health records that have been collected for the purposes of the child care facilities on site. They can go through those, identify children who have screenings that haven't been done, who might have immunizations that need to be brought up to date, and other health concerns that the child care providers may not really appreciate because they're not child health providers. Child care health consultants provide knowledge and develop strategies for inclusion and management of children with special health needs. They can connect families and staff with community health resources, and referring children and staff to medical providers in the community is an important role that child care health consultants can play. And they support providers in improving quality ratings and obtaining accreditation. Child care health consultants can go through the requirements for NAEYC accreditation, go through QRIS standards, go through licensing requirements, and find those health and safety and nutrition features that need to be improved and work with those child care providers to bring those up to speed. And they do that because they're there on a voluntary basis without the baggage that comes with being, shall we say, a licensing consultant who's there to check off what regulations you're violating and then sanction you. Child care health consultants are there indeed for the client. So the first of the two studies I want to talk about, the first one is the Child Care Health Consultant Impact Study. It was conducted within North Carolina. We had about 14 child care health consultants specially trained for this study in 77 child care health programs throughout the state. And all of those programs were either urban or rural. They could be large or small. They had all quality rating license levels. This study goes back to the first half of the 2000s, somewhere around 2003, 2004. And in those days, the North Carolina Partnership for Children, which was called Smart Start, was one of the employers of child care health consultants. We were also one of the earliest states to have a quality rating and an improvement system, the so-called STAR rating system in North Carolina, which has since proliferated all around the country. Well, these 14 or so child care health consultants followed these child care centers for 2 years, collected data every 6 months. So this was a longitudinal historical study, but it was not a controlled study with a comparison group. We saw these improvements over the 24 months that we followed the effects of the child care health consultation on the ground in child care centers. We saw improvements in written health and safety policies. We saw health and safety practices, such as sanitation and hygiene. I highlighted nutrition and food service practices. Playground safety and emergency preparedness practices all improve over time. We saw completed performance of oral, developmental, vision, and hearing screenings for children in the child care centers. And at the child level, and I want to emphasize child level outcomes of child care health consultant interventions, we saw that children's access to a medical home increased. We saw that children's enrollment in health insurance increased. And we saw children's documented immunization status increase as a result of child care health consultation interventions. The second study I'd like to talk about is specifically about nutrition and physical activity in child care. And in this case, I had collaboration from Abby Alcon in California and Angela Crowley in Connecticut. Angela is here with us this afternoon. And we three, got 17 child care centers in the 3 states, signed on to this longitudinal, randomized, controlled study of child care health consultant interventions to improve nutrition and increase physical activity in child care. As you can see, we engaged 552 families. The study lasted over 7 months. And we demonstrated several levels, you might say, of improvements. We were able to change child care provider knowledge. The knapsack program, which was the intervention that we used, and one of the creators, Diane Ward, is here with us, and you'll hear her in Workshop E tomorrow. We used the knapsack trainings. The child care health consultants were specially trained in knapsack by Sarah Benjamin Nealon, who was a doctoral student and is now an associate professor, doctoral student at UNC, associate professor at Johns Hopkins. She's a co-author of the paper and helped us implement this study. We saw improvements in knowledge about childhood obesity, about healthy eating, about physical activity, about personal health, and about working with families. And let's see, they're all, with one exception, statistically significant. Now this is within the centers that actually got the intervention, of course, and we saw the change in knowledge over time. But when we were able to compare a intervention center with a non-intervention center and put these results into statistical models, we were able to show that physical activity and nutrition policies in the centers who had the intervention rose significantly more than nutrition and physical activity intervention policies in the control centers. And I hope that you'll all have opportunity to see this presentation when you go to the Dropbox, or you can even look up the study. So I'm not going to deal with the actual numbers right now. Lastly, this is the creme de la creme, I guess you would say, actual changes in children's BMIs in the centers where we did the intervention in only 7 months compared to control centers. Now, these were children who were 3, 4, and 5 years old. Our assessors were blinded to whether the centers that they were visiting were intervention centers or control centers. They had stadiometers and they had scales they brought with them that they calibrated every day. And let's see, this actually does this have a little red thing? It does. Little red thing. Well, we're going to take a little pride, I guess you would say, in this result. You can see this is the normal weight, and these here are the intervention centers, and these two are the control centers. A little increase in children at normal BMIs, not a significant increase in the control centers, but the take-home message is a decrease in children who were obese, which was reflected in an increase in children who were overweight and in children who were of normal weight. But it was the reverse in the control centers where we saw an increase in children who were obese. So this, again, is a statistically significant result. Again, it's at the child level. Again, we could measure it because we had people, child care health consultants, in the centers, boots on the ground, in child care facilities, who were working as coaches, as consultants, providing technical assistance on a regular basis to our child care providers, reinforcing the knowledge that they got in some of those workshops and bringing home these results. So in conclusion, I would like to emphasize 3 things: eat, drink, and be active. The last part is take advantage of child care health consultants if you have them in your areas. If you don't, see what you can do to create a child care health consultation program where you are. And since Debbie started out with quotes, I'm going to try to bring another quote to you before I go. And this quote is from Julie Schul, who was a Nemours staff person, who was kind enough to introduce herself to me today. And she concluded our conversation by saying, "Bring back child care health consultants." Thank you.